Good afternoon, and thank you for inviting me to talk today about our experiences in the Tasmanian Health Service, where we've been integrating choosing wisely into the daily operational activities of our health service. I'd like to share just in the next 7 minutes our story and hopefully things that you can learn from us, and because we've certainly learned a lot from everyone else around this wonderful community of practice. Welcome from Hobart, Nipaluna, on the island of Lutruwita, Tasmania, and I acknowledge and pay respect to the Tasmanian Aboriginal community as the traditional and original owners and continuing custodians of this land. So this will be a familiar story to many of you. I've been involved with Choosing Wisely for over 7 years now. Started off back in 2014 as part of the ASIM Choosing Wisely working group, developing the original. Well, we couldn't come up with 5 recommendations. We did 6. Launched, of course, in 2015. And then I started having what's probably hundreds and hundreds of coffees with all sorts of clinicians, consumers, and anyone who would listen. Originally around the Royal Hobart Hospital from around 2017, where in 2018, the executive got behind us and we became a champion health service. And then we went a bit broader, started having chats with more and more people around the state and building up a wonderful network. Never met a person who didn't like what I was talking about, and certainly recognized the need for stopping doing stupid stuff. And we're all set to go a little bit more, and then 2020 came along, and probably the less said about that, the better. Look, in retrospect, it's probably actually wasn't a bad thing from the point of view of the Royal Hobart was under immense pressure. We're doing a rebuild. We've been plagued by access block, as have many health services around the country. But our CEO, Susan Gannon, was very keen for us to do what we wanted to do. So we bypassed the Royal Hobart and moved into the Central Health Service, where I was introduced to Nicholson, who's now the full-time project manager for Choosing Wisely in the Tasmanian Health Service. And it's through Marcy's work that we've been able to really make some grounds, that if we just stayed within the confines of the Royal Hobart Hospital, we might have even withered and died there, because it would have still been just me doing this from the side of my desk. I'm a clinician, I'm an emergency physician, and I don't really know about any of this stuff that's on the slide right now, having things about governance and project initiation and planning documentation and working and weaving the way through the various aspects of a complex health system. Fortunately, Marcy, in her role as project manager, she does understand that, and that's absolutely brilliant. And by launching that synergy between my on-the-ground clinical work and my, I guess, street cred, and Marcy's knowledge of the system, we've been able to build something that I believe is sustainable and unique. And we're now faced with Tasmania being Choosing Wisely Tasmania, and the whole state basically a champion health service. And I'd just like to talk a little bit more about that. Feel free to pause this. This is a fairly busy slide, but it essentially describes that we feed into the Business, Innovation and Reform Subcommittee, which reports directly through to the Secretary of Health. And we're a sustainable part of that. Excuse me. That is very exciting to me. That means that we have street cred in the organisation. I'm still working with all the clinicians anywhere and everywhere. We've got a fantastic steering committee with the chief executives of all the major Tasmanian public hospitals and myself as the clinical lead. We've got access to all sorts of people who know things, such as health economics, communications, human resources, change management, finance. It's absolutely brilliant. So I think we've achieved that desire to have that top down. I've done the bottom up stuff. Marcy's brought the top down, and together we're making beautiful music. So we're a key priority project. The Secretary loves us, and we're going to be doing exciting things. One of the innovative things that Marcy came up with was that a proportion of savings realised will be reinvested in the program, both at a program level, but also at the unit level. So there's that financial incentive. And so it's going to be very interesting to see how that goes. We've got a formal management framework in place, and we're starting to do a lot of things. And many of you have already been doing this for years. We're doing it to demonstrate that this is doable. So we're starting with the low-hanging fruit, the coagulation profiles, the IV cannulae, opioid prescribing and stewardship, imaging. There's a whole lot of other stuff out there that we're starting to talk about. And a big shout out to David Alcock. Please check out his poster about pre-assessment clinic at the Royal Hobart Hospital, about how it's totally reforming the way that patients are assessed going into surgery. And it's very exciting how that's all happening. And so people are on board. And there's also a lot of informal stuff happening. So we've developed a lot of tools building upon what other people have done in other jurisdictions, the project initiation process, the prioritization tool, various project templates. We're still working on building more and more consumer and clinician engagement and awareness, working with Consumer Health Tasmania and collaborating with other jurisdictions, including some of the work that Diana Edgerton-Warburton is doing about the just-in-case IV cannulae in Melbourne and beyond. And we're also very much inspired by the wonderful work that the Prove ED team is doing in Southeast Queensland and more broadly in Queensland. So lots of, we've learned a lot from everyone. So what have we learned? Look, active engagement at all levels is essential. We all know that. Wank word warning, building on the synergies of clinical administrative expertise and find the right people. That's absolutely critical. From the point of view that I'm doing my clinical work, I can talk to clinicians. Marcy brings in a skill set that I could never dream of having, and together I'm really actually genuinely excited, which is amazing. And of course, we have different pitches for different people, as I'm sure you all have your different elevator pitches. The way you talk to a clinician is different how you would talk to an administrator, and that's worth noting. I think the big thing I've learned is about you need to be patient. These things do take time, and you don't just go and grab the first thing you can. We're here for the long term. 7 years so far, I'm looking at this as being systemic structural change in the health system. It doesn't have to be done overnight. Jumping in too early would have run the risk of getting the wrong people involved and burning me out. We're going at just the right pace. And that's why I think the big message is insisting upon and waiting for systemic, sustainable solutions that aren't dependent upon individuals. I can go and do something else now. This will still stay a part of the system. And that's very satisfying. So where to next? Well, it's going to become a part of everyday business. I think it's sustainable, and I think we're showing that intrapreneurial spirit, which is essential in big, cumbersome health services. You know, most of you think Tasmania Health Service is small, but we're just as big as Queensland Health, just compressed into a tiny island. So you've, well, obviously not literally speaking, but it feels like it. You know what I mean. But, you know, working further with clinicians and consumers, and the exciting thing, I think the sky's the limit with what we've done here by setting this up here. You know, it's not just choosing wisely. I think we can identify all aspects of low value care. We can bring in data from things such as the Atlas of Healthcare Variation. We can really go anywhere. And this is going to open us up to have a structure and a process to really engage with consumers, clinicians, administrators, everywhere, to be that entrepreneurial group who can attack the 30% of the health service stuff that's wasteful and 10% of the healthcare system that's actually harmful. And who knows where we can go beyond that. Health funds, the private health system, really, I think this is very exciting. Looking forward to what we can do. We're already doing good things. It's potentially even more exciting. I'd just like to finish up by quoting one of my favorite people. I was a big fan of well, obviously, he died literally the day before I was born, or the day after I was born. But so maybe this bit of his spirit jumped into me. But President Eisenhower, who of course won World War II, as a senior general, as the commander of the Allied forces, he understood the military-industrial complex. I'll leave you to read that fantastic quote of his about how by spending all this money on military hardware is an opportunity cost. I wonder if maybe the spirit of President Eisenhower was Dr. Eisenhower and what he would make of the medical industrial complex. And so I've paraphrased the great man there, and I'll leave you to take that into account. So thank you very much. And please email me. You can find, you can find me on Twitter, or just Google me and I'll be there somewhere. Send us a message. All the best. Bye.